Good evening, Colt here again, and I am going to try to continue telling a coherent story about my stomach cancer diagnosis and treatments. I've got Lily and Rosie here keeping me company, and I'm starting off like usual with my trusty bottle of Ardbeg Anoa. Now, this is actually getting filmed a day earlier than I normally would, and I've got a very specific reason for that. So, 3:30 in the morning on September 25th, 2019, I woke up and got carted off to the University of Minnesota Medical Center for my total gastrectomy. And I wanted to have this video ready for 3:30 in the morning because that is a significant time for me. I actually still have the alarm set on my phone from that day, and I'll always keep that. But before we get there, I want to fill in a little bit more of the story leading up to my leading up to my surgery. We know about the diagnosis. We've been there before already, right? So after it was decided that we were going to cart me off to surgery a bit early, I had a few weeks, I think 3 or 4 weeks off, not more than a month though, before my surgery was to take place. So during that period of time, no chemotherapy. They wanted me to try to rest up as much as possible. But another big important thing that I had going on is I had been asked to be best man at my buddy Sean's wedding. And we didn't know for a while if I was going to be able to, but it was something that I really wanted to do. So bald me, no hair, didn't fit in any of my suits. I had to go out and buy a suit to get it to fit. And my dog's going crazy now next to me, so sorry about the distraction. But I was definitely motivated to be there, not only for Sean and his wife and his family and both their families, but I really wanted to be there for myself as well, because this was a good friend of mine and I was going to get to see some friends that I didn't get to see very often at that point, including friends from out of town. So I made it through that. I did not look pretty. I looked like a big bloated mess, but I made it, and that was a big deal to me. Now, that was, I think about September 20th, and I had surgery then just a few days later, so it was really my last hurrah. September 24th, I had training at work, and my coworkers got me a cake as well, because it was the day after my birthday, September 23rd, but also I knew it was quite possibly the last time I'd be able to at least enjoy birthday cake. One of the fun things about folks who make it through a gastrectomy is we wind up having a really love-hate relationship with sugar. We still like the taste. We don't like what it does to us though. So I wanted to get my sugar kick in while I could. Rosie, you're being rude. She doesn't care. So now we're kind of caught up to September 25th. And this is probably going to be kind of a jumbled story, largely because I was in the hospital for a week with very little to do, and I have a hard time remembering exactly when certain things took place, what days they occurred, etc. So I'm going to try to be as coherent and linear as possible, but I'm inevitably going to fail a bit. So again, September 25th, wake up at 3:30 in the morning, I get carted to surgery. And the fun thing about that is first of all, you have to like wash your entire body with this antimicrobial scrub. Then I go to the hospital. When you get to the hospital, you basically sign a form saying, take whatever of my guts you need to. You need my spleen, take my spleen. Pancreas, it's gotta go, guess it's gotta go. So it's basically giving them a blank slate to do whatever they feel they need to do to get you through surgery. Now, something I think I referenced in one of my prior videos, but I'm going to reiterate it right here. I kind of went against the grain when it came to a lot of the recommendations I got from family and friends and coworkers with regards to who did my surgery. Now, No surprise, I'm in Minnesota. There happens to be a very big, well-known medical system here, and in fact, it's one that I've recommended a number of people who I've mentored to, both in the past and recently. But I really felt connected to a surgeon with the University of Minnesota. And the big thing for me, and it's a memory that's going to stick out in my head for the rest of my life, and it's something I might actually become a bit emotional discussing when we get a little bit further on in this stage of the story. But the surgeon that I met at the U of M really struck me as kind of, for lack of better words, a really, really decent human being. He had good bedside manner, really seemed to be caring. And the big thing for me is he seemed like somebody who wasn't just going to give up on me. And that was my concern with the other surgeon that I had interviewed with. The original surgeon had basically said, listen, I'm going to cut you open. I don't think your chances are good. I think that there's likely been spread. And if I see anything even remotely suspicious, I'm just going to close you back up and send you home to die. And Dr. Tuttle with the U of M really struck me as somebody who was going to not just do his due diligence. I always expect a medical professional to do that. But I felt like he was in it. He wanted to make sure that I had the best chance possible in getting through this. And that's what got me to my decision to go with the University of Minnesota. And knock on wood, not really. Spoiler alert, let's go with that. 5 years later, I'm still here. And September 25th, which is when hopefully y'all will be seeing this video for the first time, will mark 5 years cancer-free for me. So that is a huge milestone. You know, I'm still going to have some blood work and scans. It'll be my final visit with my oncologist in about a month and a half. Schedules just didn't sync up, but for all intents and purposes, this is 5 years cancer-free for me. Again, huge milestone. So I sign all my paperwork. They access my port. They tell me they're going to start giving me anesthesia, and that's it for me. That's my part of this story. And that's what they don't really tell you. Your job when it comes to surgery is to just show up. And in a lot of ways, that makes it a bit scary. But for me, it was actually comforting because I knew that my job up to that point was to bring the healthiest body I could to my surgeon and then just check out. And that's what I did. So as I've mentioned before, I gained a few pounds in between when I was first diagnosed and when I got surgery. And I woke up after surgery. And the first thing that pops into your mind is, did they do the surgery or not? So one of the largest concerns is that you go in for a gastrectomy and they find something. And you wake up an hour later after anesthesia is worn off, and that's it. That's kind of the end of the story in a lot of cases. So my first question was, how long was I out? And the nurse gave me a number that was, I think, in the 8 to 10 hour range. And I remember thinking like, okay, they did it. It took longer than it should have, but I'm not going to worry about that right now. And I had my father, my brother, my brother's girlfriend were there. My ex was there. And they had explained that essentially Dr. Tuttle found suspicious stuff in my abdominal wall and my diaphragm. And the way that it was explained to me is in a run-of-the-mill abdominal surgery. Like if somebody had gone on for a gastric bypass or something like that and they found some of this stuff, they would probably biopsy it, but they wouldn't necessarily be concerned. But within the context of somebody who had advanced gastric cancer with suspicion of spread, kind of barely contained in the first place, there were a lot of concerns there. And this is the time when I start to think back to my decision and why I'm so glad that I made it. Dr. Tuttle had pathology on standby, and each one of those spots that they found, he removed, he sent it to the lab, he waited for a response before continuing, and every single one of those spots was benign. And so now here in my head, and this is run through so many times, had I gone with the system and the surgeon that everybody had encouraged me to go with, and he had done exactly what he said he was going to do, he would have opened me up. He would have found those suspicious spots. He would have closed me up, and I would have gone home to die, essentially. So what do you take from that? I mean, trust your gut is one thing. I don't usually like saying that. I'm always advocating for people to look at the facts, look at the stats, go with the people with the right track record. But Dr. Tuttle had a tremendous track record, and he felt like he was going to fight for me. And that was enough to put him a step above in my mind. And I'm so glad to this day that I did. So I make it through surgery, probably gnarly scar picture right here. You're going to have a few like after pictures as well. Maybe they'll be right away, maybe they'll be down the road. I still don't have this whole thing like mapped out, and editing is something I'm new at, so bear with me, please. But another thing that they don't really tell you is what they hold you together with. So I had what was called a Roux-en-Y total gastrectomy reconstruction, where they cut out my entire stomach. They took the jejunum, they basically move it up so that the bile enters your system a little bit earlier on. Maybe I'll throw a picture up here, we'll see. Maybe it'll be a crude drawing, that could be kind of fun, we'll see. But the whole idea is that you don't have stomach acid anymore, so your bile basically has to do the chemical breakdown of everything, and you have to be really diligent about chewing more and pacing yourself when you eat to make sure that you're not having too much food enter your system at any one given time. There are a number of reasons for that. First and foremost, if you eat too much at once and you don't have a stomach, you're just going to basically regurgitate it. No pictures or drawings for that. You can just have that one in your mind. Also, you can experience what's called dumping syndrome, both late dumping and early dumping. And dumping syndrome is basically when your system interprets that you've eaten too much, and specifically that maybe you've taken in too much sugar, and will basically have your system dump everything out. Again, I don't need to illustrate that. It is exactly what it sounds like here. And with late dumping, you experience reactive hypoglycemia. And that is basically when your system dumps insulin into your body because it thinks you've taken in too much sugar, even though you really haven't. And really the issue is just that our body doesn't understand that we don't have a stomach, and it doesn't recalibrate from that. So we kind of have to do it for our body. So when you get reactive hypoglycemia, your blood sugar drops, and you'll start to get shaky and warm and sweaty and eventually a little bit agitated, confused. And if you don't know what's coming the first time, it is a really unpleasant and scary experience. And I didn't know it was coming the first time, and that was a little bit further down the road, so I am digressing, and my apologies for that. But what I was going to say is what most people don't expect is that after you have a gastrectomy, you're not just going to lay there. And in fact, I was told pretty much immediately, you need to get up within the next 2 hours and walk around. I'm like, okay, cool. What am I held together with? And the response really kind of shocked me because I'm expecting basically what I had seen online, which were staples, big stitches, like these gnarly incisions. And I had an open gastrectomy, meaning I had a scalpel cut, and it goes from my navel all the way up to my sternum. And I remember lifting up my gown, and there's a damn piece of tape there. And I asked, like, okay, so what am I held together with? And they told me essentially glue and a tape, a big piece of tape. That was it. So of course my mind goes to this place where I'm gonna like bend over and my guts are gonna fall out. Thankfully that was not the case. That stuff worked wonders, and it left a very, very minimal scar based on, or at least compared to what I expected. So I forced myself to get up, and I am stubborn. They offer to get me a walker, and I say no. They offer to help me up, and I basically tell myself, like, no, I need to be able to get up on my own because I'm not going to be carried into the bathroom. I don't want to use a bedpan. I want the catheter out of me as soon as possible. So this is the way it's going to have to be. And I did. I dragged my ass up out of the bed, and I got winded walking around a quarter of that particular unit. But it was a start. And I had all sorts of fun issues in the beginning. That my O2 sat was all over the place. My heart rate was all over the place. Not really sure what was going on there, but I guess I can give my body a little bit of grace since it had just been cut open and a major organ had been removed, along with a couple dozen lymph nodes. So, up, walking around, finally see the doctor, and of course I ask, like, okay, so what's the verdict? And I'm told that the surgery was successful, margins were clear, however we have to wait for pathology, the final pathology report, before we know if it was more invasive, how successful treatment was, all of that fun stuff. So it's a waiting game. And I know that I'm going to be in the hospital for 7 to 10 days. And I basically said from the beginning, I'm going to be out of here in a week. I don't want to be here any longer than that because it is boring. Yeah, I had books, I had my Nintendo Switch, I had my phone, I had my iPod, I had things I could do, but at the end of the day, you're just kind of laying there. And even though yes, I could get up and walk around, I couldn't walk around much. I could walk around the unit after a day or two, but it's not like I was going for a mile-long walk, and also they keep a really, really short leash on you. So my options were a bit limited. And also, they don't let you eat or drink anything in the beginning. So I was able to sneak some ice chips, and I don't know if you know this, but if you suck on an ice chip, it turns to water. So I kind of cheated a little bit there. And I was also mobile enough to be able to figure out where the freezer was. So even though they weren't letting me order anything from the cafeteria, I found out where they kept the popsicles. And I definitely had my fair share of those because it was nice to have a taste in your mouth that wasn't just like medicine taste. Now, the other fun thing, I don't do well with opiates. They really don't do anything to me. And they had me on the regular pain pump, but they take that away pretty quick. And really the only thing that I had that was giving me any sort of relief in the beginning was a spinal block. And after the first full day, they take that away too. So I went through recovery on nothing but Toradol, which is an NSAID. But after you've had a gastric surgery, NSAIDs are the devil. There's a GI bleed risk. And what do you know? I've got GI bleed from getting my guts cut apart, so they can't really risk that too much. So I had like a couple days of Toradol, and that was it. No pain meds. Really, it wasn't bad though. I was expecting a lot of pain. I will tell you that having herniated discs in my back was a lot worse when it comes to pain. So yeah, gastrectomy, not so bad. But again, no food, not at least for a few days, and then they let you have broth. And boy, it was nice to be able to eat something, but it's also disappointing when it's just broth. If you're able to keep that down, they send you for a swallow test. And swallow tests are not a blast when you've just gone through surgery, because they kind of like strap you to this table, and you start off lying down. First of all, you have to drink this absolutely noxious fluid, and I've been told that the stuff that they give you is so noxious that they will sometimes give it to people with bowel obstructions just because it has a tendency to clear it out. I think it's got to just be like a medical version of Drano, to be honest. But anyways, drink this awful garbage liquid, get strapped down to this gurney that rotates and tips, and it basically brings you up and it rotates you around, and the entire time they're filming your insides to see how that liquid travels through your body. Thankfully, they determined that there is no leak, and I am then upgraded to being able to get my first semi-solid foods. So I had like mashed potatoes, I think, and that was it. And then eventually I had like a chicken breast and mashed potatoes, and I had, I think like a breakfast sandwich or something then one morning. Those things didn't necessarily make me feel great. I didn't throw any of it up though, so that was a fantastic thing. But once you get to that point, they start to think, okay, you're walking, catheters out of you, you're eating, you're keeping food down, you're able to expel waste. That's a big thing. All those things are working, so it's about time to start talking about discharge. But a few things are still kind of waiting. I still had tubes in. Now, one of them was a feeding tube, and they had tested me on the feeding tube, but they decided that since I was eating and seemed to be keeping it down, they were going to keep the feeding tube in, but they weren't going to use it. So they would expect me to just eat on my own. And I also had a drain tube on the other side. And as we're starting to talk about, discharge, that's kind of the final piece. And I'll get to that part of the story in a bit because it's funny to me. It might not be funny to everybody else. But one of the things that I mentioned that we were still waiting on is that pathology report, which would really kind of tell me how things were going to go from here on out and what my prognosis was. Because I knew that if the pathology report suggested, first and foremost, the treatment was as successful as scans had suggested, that would make my prognosis significantly better than if that was a basically false positive, or I should say false negative in this case. Also, it kind of tells you, was the surgery as successful as we had hoped? So were the margins actually clear? So I also need to fill in one other piece. Now, one of the unfortunate parts about being in recovery from surgery, and I know I'm jumping around a lot, I promise I'm actually leaving a lot of stuff out, and if those things become important, I will try to re-inject them, but for the time being, I'm going to try to keep moving forward with this story. I would get woken up a lot when nurses would do their rounds, so there's not really any sustained period of rest, and I'm a light sleeper anyways, but they're coming in to check your vitals, they're doing finger pricks, they're drawing blood, they're doing all that stuff kind of regularly. But the one consistent thing is every morning I would wake up and Dr. Tuttle would be in my room. It would be like 6 o'clock in the morning, and I was the first person that he would come to see on his rounds. And on the day before I was discharged, and I always asked him about the pathology report, and he would tell me, we're still waiting on it. He was very realistic with things. He said, I think there's like a 50-50 chance it was in your lymph nodes, just being realistic, looking at the statistics. And on the day before I was discharged, I woke up and my room was dark, and I kind of, leaned up and I looked to where Dr. Tuttle always was, and he was sitting there in the dark waiting for me to wake up. And he came over to me and he took my hands in his hands and he said, and I'm paraphrasing at least a little bit because it's a very emotional memory for me and it's tough to get those things 100% right, but he tells me that they had gotten the pathology report back and they had gotten it all. My margins were completely clear. Every suspicious spot was clear. All my lymph nodes were clear and there was no evidence of any cancer anywhere outside of my stomach. My stomach had a few individual cells, individual cancer cells, and a few small groups, but it was considered to be a complete or near complete response to chemo. And what struck me, as I'm of course thinking back again on my decision, it struck me that this surgeon who has to see all of these gory things was so human. And I noticed that he was tearing up as I was tearing up. And that was just such a powerful thing for me. And it really reinforced my decision. I mean, aside from the fact the dude had saved my life, but it was such an honor to have someone who is such a good human be able to take care of you. And I can't thank him enough for the second chance that he gave me. So now I want to try to end on a lighter note. So I'd gotten good news. I knew that I was going to be discharged probably the next day. And the stories are true. If you're ready to go, hospitals want to kick you out the door as soon as possible. And it's not because they don't care. It's because they have other patients they need to serve. And I was pushing to get out as soon as possible anyways. I didn't want to be there any longer than I needed to be. I'm a stubborn hard ass when it comes to this stuff, so I figured I needed to get out and start recovering on my own terms now. So I had made arrangements for a ride, and the one piece that was missing is I still had this drainage tube that needed to come out before I left. So I went and got the resident that I had been working with. And by the way, that amazing incision that I had was not made by Dr. Tuttle, the expert master surgeon. It was the resident who wants to go into trauma. And at this point, 5 years down the road, I'm sure he's doing great things in wherever he wound up. But that was his incision, and it was amazingly straight. I had nurses coming in and showing off this incision and how it was the cleanest incision that they had seen on an abdominal surgery. And that's not hyperbole. On the rare occasion that I'm seen without my shirt on, people will sometimes ask where my scar is, and it's front and center. It's just that tiny, at least in comparison to what people expect. I also went and spoke with my favorite nurse, James. So I got the resident, I got my nurse, and I said, all right, we need to get this thing out. And I will also say that I absolutely deserve what came next because I terrorized those nurses. And I don't mean that I was rude, not at all. You don't be rude, you don't be mean to the people who are taking care of you when you are incapacitated, that's for sure. But people who know me know that I like to joke around, and I've got a pretty dry sense of humor. So for instance, the first nurse that came and spoke to me after I was initially out of anesthesia and had fallen asleep again, she did kind of the mental status exam, do you know who you are? Do you know why you're here? And I said, no, I don't know why I'm here. I came in for a tummy ache. What's going on? And just the shock in her eyes as she's thinking like, oh no, this guy doesn't know why he was here or something's wrong. So as soon as I saw that, I had to just let her know, like, I'm just messing with you. I know why I'm here. So she gave me a hard time all throughout the stay as well. I gave James a hard time as well, but he happened to be the one who was most often there at night. And I would be up like walking around when the corridors were empty, trying to get my steps in, trying to recover as best as I could, and trying to get ready for the inevitability of going home to take care of myself. So we're caught up again, really kind of Tarantino'd this story, and I apologize for that. I had gotten the resident and James and said, all right, it's the end of the day. I know people are going home, and the resident was on his way out the door. It was at like 4:30, but I need to get this drain out so I can go home too. And James says, all right, I'm going to go take care of everything. I got to go get the cart, get the supplies, and I just want you to lay on your bed. I want you to lift up your shirt, and we will come and take care of everything. And what comes next is a bit funny to me. And it was probably, looking back, the best way to do it, but boy, I can see how it would terrorize somebody. So I asked, do I need anesthesia? Like, what's going to happen? Because I know that this drain basically goes in my flank, kind of snakes throughout my body, and it actually winds up over on the opposite side. And James tells me, no, you don't need anesthesia, you don't need anything. It's just like pull starting a lawnmower. And I laugh, James laughs, the resident literally rips that thing out like it's a pull starter at that moment as I'm laughing and James is laughing. He was not kidding. It was probably the best way to explain it and also disarm me at the same time. It didn't hurt, but it was the most otherworldly feeling I've ever had, because even though we don't necessarily feel things on the inside of our body like we do with our skin and our, our touch, you still have a sensation there. And it was like some sort of alien worm getting pulled out through my body and ripped out. So now whenever I watch one of the Alien movies, I kind of feel like I understand that a little bit more, that whole body horror piece. But thankfully that goes well. They basically just put a compress over it, tape things up. Your body's actually really good at sealing up after those things are removed. So thankfully not a lot of maintenance there. And I get sent home. I had a buddy pick me up. We stopped at the grocery store. I got some foods to try. And I'm now at home. Try to figure things out. And at this point in time, I don't know what the plan is moving forward. I needed to be able to talk to my oncologist and figure out if we were going to continue chemo, because I wanted the kitchen sink thrown at me, but the initial plan was to do 6 to 8 rounds ahead of time. We also knew that chemo was way more effective than they had originally expected or planned for. So that puts you in kind of a gray area. I didn't quite fit with any of the models. And I was at a point where I think my brain logically said, let's just finish up what we started. Let's get it over with. Emotionally, I'm thinking like, okay, chemo's probably not going to get any easier. And it's kind of gross in the first place, and I would kind of love to just continue with this whole physical healing without having to get sick again for another few months. But at that point in time, that wasn't my primary concern. Really, for me, during that period of time is I played some video games, I read, I watched some TV, I caught up on movies. Thankfully, I think that was right around when The Mandalorian was released, so I got to watch that, and that gave me something to look forward to as well. And I walked a lot. I couldn't carry a ton, and I wasn't driving initially. Although they didn't restrict my license because I wasn't on any painkillers. I wasn't on any meds that would affect my ability to drive, so I was given a free rein to use my car as soon as I wanted to. However, I really wanted to focus on walking. So I had a Target about a mile away, and I would typically only buy groceries to last me for a day or two, because it would force me to then get up, walk another mile, and then walk a mile back. So that's basically how I spent my time up until my next consult with my oncologist. And yeah, we'll talk about that in the next video. But again, I'm posting this on the 5th anniversary of me being declared cancer-free, because on that day, we knew that every cancerous cell, at least that they could detect, was out of my body. And in the intervening 5 years, they've never found anything suspicious on scans again. So I'm calling this my 5-year celebration right now. But I also want to share this with the fantastic folks that took care of me all the way through. So Dr. Robinson, who really, I have to say, is the reason that I got diagnosed as early as I did, because he took me seriously. Dr. Jha, who did my my chemotherapy, was my oncologist. Dr. Tuttle, who did my surgery. And that entire team that was there for me, helping me recover, getting me through. I literally, obviously could have gotten through this without them. I mean, there's no way that I could have done like auto surgery based on YouTube videos, of course, but I mean it from the human standpoint. They offered so much support, so much help throughout that time, and I could not have done it without them. So I'm here 5 years later, but I'm here 5 years later because of a lot of people's effort, and I just want to take a moment to recognize that. So thank you very much, and until next time.